Hi, my name is Dr. Irwin Goldstein. I'm Director of Sexual Medicine here at Alvarado Hospital in San Diego, California. This is the sixth in a series of educational videos concerning the reconstructive surgical procedure penile revascularization. Penile revascularization is a non-pharmaceutical, non-device treatment strategy for a select group of younger men with erectile dysfunction secondary to blunt trauma-associated blocked arteries to the penis. This sixth video will focus on scientific data in an evidence-based fashion that clearly distinguishes the safety between the noseless bicycle saddle and the traditional narrow saddle with long protruding nose extension in preserving both erectile function of the penis and sensation of the penis during bicycling. There are numerous scientific publications supporting the safety of the noseless bicycle saddle versus the traditional narrow saddle with long nose protruding extension. Excellent safety data have been published by NIOSH, the National Institute for Occupational Safety and Health. NIOSH is charged with the provision of information in the area of occupational safety, especially for bicycle riding policemen. In this slide, the Occupational Safety and Health Act of 1970 states that no employee will suffer impaired health or functional capacities or diminished life expectancies as a result of work experiences. In this video, please review the NIOSH studies and published results on www.cdc.gov/NIOSH/topics/bike. This next slide shows the NIOSH published research concerning penile erectile function and penile numbness related to bicycle saddle pressures. The bottom line is that bicycle saddle pressures for a noseless bicycle saddle are placed on the sit bones. Bicycle saddle pressures for a traditional narrow saddle with long protruding nose extension are placed on the artery and nerve to the penis. Again, please review the studies, www.cdc.gov/NIOSH/topic/bike. This next slide shows the difference between the noseless saddles on the left and the traditional narrow saddle with long protruding nose extension. As can be seen, the narrow saddle is not wide enough to bear the weight typically on the male ischial tuberosity or sit bones, and the long protruding nose is clearly too narrow to bear body weight on the sit bones. This next slide shows saddle pressures while sitting on a chair or noseless saddle. You can see on the left the pressures are dedicated to the sit bones. On the right, using the narrow bicycle seat with protruding nose extension, you can see that the pressures are basically placed on the perineum. On the bottom right, you can see that the pudendal nerve and pudendal artery can be permanently injured from bike saddle compression, where the bike saddle is narrow and there is a long protruding nose extension. This next slide looks at the duration of nighttime erections on the Y vertical axis against on the X horizontal axis nose pressures as recorded in bicycle policing officers. The nighttime erection monitors were performed during several nights of sleep. The data reveal higher duration of nighttime erections in police officers with lower nose pressures. The data further reveal less duration of nighttime erections in police officers who used traditional narrow saddles with long protruding nose extensions who had high nose pressures. This next slide shows a study performed again by NIOSH called Cutting Off the Nose to Save the Penis. The top representation shows saddle pressures. On the left, saddle pressure in a noseless saddle shows no pressures in the perineum, while that on the upper right shows pressures on the perineum. The middle graph shows those individuals who use the no-nose saddle. The red bars had less opportunity to have numbness. The lower graph shows erectile function in individuals who used the no-nose saddle had higher erectile function in yellow, And in the red, that was those police officers who used the traditional narrow saddles that had long nose protruding extensions. The next slide is the NIOSH report. I will read to you the marked up section of this NIOSH science blog. The traditional bicycle saddle has a narrow nose or horn that protrudes under the groin as the cyclist straddles the bicycle. Ideally, the weight of the cyclist supported on the saddle should be under the pelvic sit bones. However, 25% or more of the body weight is supported where the groin contacts the saddle nose. This percentage greatly increases as the cyclist leans forward in more aerodynamic positions. Bearing weight on this region of the saddle compresses the nerves and arteries in the groin. These nerves and arteries run through the groin between the sit bones to the genitals. Research has shown that pressure on these nerves and arteries over time may lead to a loss of sensation and a decrease in blood supply to the genitals. This can contribute to the sexual and reproductive health effects that have been reported with bicycling. To continue the focus of video 6 on vital safety differences between the noseless bicycle saddle and the traditional narrow saddle with long protruding nose extension as it relates to penile erectile function and penile sensation, please listen carefully to this video actually produced by NIOSH several years ago.
A traditional bicycle saddle has a narrow protruding nose that compresses pudendal nerves and arteries forward of the sit bones. A no-nose saddle is one that does not have a protrusion of saddle material between the legs into the groin of the cyclist. The saddle must be designed in such a way that the portion of the pudendal nerves and arteries that are forward of the sit bones are not compressed under any part of the saddle surface. This is illustrated as follows. A no-nose saddle does not have the portion of the saddle compressing the pudendal nerves and arteries forward of the sit bones. NIOSH has studied the effects of bicycle use on the reproductive health of police bicycle patrol officers. In the most recently published NIOSH study, nearly 100 bicycle patrol officers chose a no-nose saddle to try for 6 months. The no-nose saddles reduced harmful pressure in the groin for these officers by more than 65%. At the end of the 6-month study period, 90% of these officers had continued to use a no-nose saddle, and improvements in reproductive health were reported. The study concluded that no-nose saddles can be safely and effectively used in bicycle patrol work. This video was produced by the National Institute for Occupational Safety and Health in August 2009.
Thank you for listening to the NIOSH video. I thought that adding this one slide would help the educational value of this video. This is again found on www.cdc.gov/NIOSH/topics/bike. This is an article by Sergeant Joe Andruzzi of the Chicago Police Department. It's entitled "Noseless Saddles Provide Protection." I'm going to read the marked up portion. I realize reading a short article won't change the minds of those who vehemently oppose switching to a no-nose saddle for reasons ranging from ignorance to obstinacy. However, I encourage any officers who are concerned about their reproductive health to try a no-nose bicycle saddle. If you do, be patient. Your body needs time to adjust. Just know that if you make the switch, Your penis will thank you for it. Again, www.cdc.gov/NIOSH/topics/bike. With the release of the scientific and evidence-based NIOSH data that noseless bicycle saddles provided safety advantages concerning both penile erectile function and penile sensation, as compared to traditional narrow saddles with long protruding nose extensions, several news media contacted us to do interviews. Please see a local San Diego interview on this topic.
And bikes could be making men numb. You'll want to hear this before you take a seat.
Serving all of San Diego, this is your Fox 5 News.
There was an unusual study by the Centers for Disease Control. They looked into the impact that bicycle seats have on riders. As Fox 5's Perrette Godwin tells us, it's a study that's getting a rise out of cyclists.
I find the noseless saddles about as comfortable as sitting on a wooden planked swing set.
Aaron Pekka isn't buying the latest study from the Center for Disease Control and National Institute for Occupational Safety and Health.
Men who ride in saddles that are narrow have a higher level of sexual problems than men who ride in wide seats without nose extensions.
I've been riding bikes in San Diego for 31 years, and I've never had a problem.
He may be in the minority. Dr. Erwin Goldstein with San Diego Sexual Medicine at Alvarado Hospital explains what happens to riders on standard seats.
Their genitalia gets smushed, and the nerves and arteries to their genitalia get smushed.
This is how he describes what happens on a bicycle seat. On a seat like this, blood flow is lost for the entire time a person is sitting on it. On a no-nose seat, blood flow continues.
Put your finger where the artery and nerve are.
Right here.
Free from any issue. So you lean forward. Put your finger where the artery is.
Well, it would be underneath
right,
here.
It's being compressed.
A bicycle seat is what Dr. James Sinclair believes caused the medical problems he was having.
I was starting to have some health problems that didn't make sense to me.
Sinclair says the problems began a year ago.
The timing is, I correlated perfectly with my picking up the bike, the spinning, and actually expanding upon over the last year.
After a consultation with Goldstein, he's now a believer.
As a scientist, pretty convinced that that is the cause.
Perrette Godwin, Fox 5 News.
Again, to continue the focus of Video 6 on the critical safety differences between the noseless bicycle saddle and the traditional narrow saddle with long protruding nose extension, in particular as they relate to penile erectile function, please examine this next video animation of the blood supply to the penis. Please carefully observe the close approximation of the erection artery to the pelvic bone called the ischiopubic ramus. A noseless saddle will not cause excessive compressive forces to this artery to the penis. However, a traditional nose saddle with long protruding nose extension, because of its narrowness, can cause excessive compressive forces to this artery to the penis, leading to permanent blockage or narrowing, resulting in erectile dysfunction. Every day, bicycle riders who use traditional narrow saddles with long protruding nose extensions damage the artery to their penises, resulting in erectile dysfunction. Here are several arteriograms of young men with erectile dysfunction who have ridden on traditional narrow saddles with long protruding nose extensions. Please see the blocked erection arteries in the red ovals. Should a young man develop erectile dysfunction who suffered an injury during bicycle riding that blocked the erection artery, this man may consider penile revascularization as a microvascular reconstructive treatment option. We have performed over 1,500 such procedures since 1981 when we started. We have a restoration of erectile function rate of 2 out of 3 patients. I thank you for listening to this video. I hope that if you are a bicycle rider, you too will consider now using a noseless bicycle saddle.